Hi, everyone, and thank you so much for joining us today. My name is Erin Schwartz, and I'm the B2B Marketing Manager here at iHire. I'd like to welcome you to our webinar presented in partnership with PeopleWorks, Employment in a COVID-19 World, Getting Back to Work, a New Normal. At the end of our presentation, we'll have a live Q&A. So throughout the webinar, please enter your questions into the Q&A chat box at the bottom of your screen, and Lisa will do her best to address them. We've got a lot of great content to go over, and we will probably take close to the entire hour. However, we know how important and valuable the Q&A is, so Lisa is happy to stay after the webinar to answer your questions live. If you're unable to stay, just keep an eye out for the follow-up email, which will have a link to the recording of both the presentation and Q&A. So in a moment, I'm going to turn it over to our host, Lisa Schuster. Lisa is the founder and president of PeopleWorks, an HR consulting company that provides innovative and scalable HR solutions with a strong focus on employee engagement and culture. To give you a bit more background, she has more than 20 years of experience serving as an HR leader. She's a SHRM Senior Certified Professional, as well as a Senior Professional in Human Resources. So before we get started, we wanted to poll the group to get a bit of background about where your company stands as far as getting back to work. So when you're ready, please go ahead and select your answer on your screen. All right, when is your company planning to have employees physically return to work? All right, and then one last question. Approximately what percentage of your staff do you expect to return to the office upon reopening? All right, thank you guys so much for your feedback. So with that, I'm going to turn it over to Lisa.
Thanks, Erin. And hi, everyone. It's nice to be back. And we know that employers will probably start bringing employees back into the workplace in the foreseeable future, since states are starting to lift their restrictions. And what we do know is that the workplace won't go back to pre-COVID conditions anytime soon. There will be a new normal for all employers, and there will likely be new or modified regulations or employer obligations. And so the purpose of today's presentation is to provide you with some practical guidance about what you should be thinking about and planning for now in order to best prepare for reopening or continuing operations once stay-at-home orders are lifted. So please know this continues to be a very fluid situation. And so if you're listening to a recording of this webinar, please note that this information is current as of May 14th, 2020. New guidance and federal and local orders will most certainly continue to come out. So here's what we're going to cover today. OSHA and keeping your employees and workplace safe, screening, FDA, and FMLA and ADA, working from home, compensation, furlough and layoffs, recalling your employees, and then, as Erin stated, we'll have that Q&A, and so let's get started. So in bringing your employees back, communication, it's going to be key in helping your employees feel safe and confident confident about coming back to work. And so first and foremost, you need to communicate your justification for bringing your employees on site in the first place. Your employees may be understandably nervous, and they're going to want to know what you're going to do to protect their safety and promote their health during this time. And it's important that you not only communicate this to them, but also that you document it in a safety and infection control plan, and you provide employee training that covers, here's everything that we're doing to protect you in this environment. And so this includes policies and procedures for things like, here's how we're bringing workers back in phases, taking employees' temperatures and conducting health screening, here's who's going to continue to telecommute, here's how we're staggering work days, here are our site sanitizing guidelines, here are our social distancing guidelines, here's what happens when someone gets sick, et cetera, et cetera, et cetera. And other than keeping your employees safe, communication will be the most important thing that you can do. And employers who communicate with their workforce and act in ways that demonstrate genuine concern for employee health and safety will probably see reduced risk of worker illness or further outbreak, and they'll also see increased productivity. So let's talk a little bit about OSHA. So the OSHA General Duty Clause requires, and I quote, that each employer furnish to each of its employees a workplace that is free from recognized hazards that are causing or likely to cause death or serious physical harm. So obviously safety must be your first concern, and if you don't make a concerted effort to provide a safe work environment, you're opening yourself up to liability. And the last thing that you need right now is an OSHA inspection or a lawsuit. And there are already lawsuits, more are sure to follow. Now, if you're providing a safe work environment, it would likely be an uphill battle for an employee to prove that they contracted the disease at work, but these lawsuits will be costly to defend, and that's a loss for your business, even if you ultimately win. And so these safety measures that we're discussing today, they're recommended by the CDC, and the more safeguards your company can adopt, the better your argument is going to be in the case that you're challenged. Now, what OSHA wants to see, and that's not literal, so please don't send this to them, but they want to see a safety and infection control plan. Now, you really should already have one, but unless you're a large organization or in healthcare or another high-risk industry, it's possible that you don't. Now, if you don't, you need to draft one. You don't need to agonize over it, but you want to have basic infection prevention measures that you're thinking about, and you want to develop policies and procedures to identify and isolate sick employees, and you want to determine what happens if you think someone is sick. And then finally, OSHA wants you to identify workplace controls, and they have a three-way, or I should say a three-prong approach at looking at this. And so the first is engineering controls. And so this is, for example, your ventilation system. So we've probably all heard about the restaurant in China where COVID was spread because the ventilation system, rather than exchanging air, it blew it around. And so the virus was able to travel around the restaurant. And so you want to tweak your system to ensure that it's bringing in plenty of fresh air and removing stale air. You want to consider adding physical barriers. Consider putting sensors on your light switches. I have one client that is in the midst of installing touchless faucets. And so engineering controls, those are the modifications that you can make where employees don't have to do anything or change their behavior. Now, the second is administrative controls. And this is, these are things how we schedule our workplace, how we isolate our sick employees. It also includes things like health screening and social distancing. And we're going to discover that or cover that in greater detail momentarily. If you've been closed, you want to get a deep cleaning before returning and then ensure regularly scheduled cleanings. And it's important that you start contracting for these services now because because these businesses are going to be very busy. And then cleaning supplies. You need to start thinking about this now as well, because they may be difficult to come by. And you also want to do an evaluation of each position to determine the level of cleaning necessary. And so for individual workplaces or workspaces used only by one person, a Clorox wipe cleaning is probably sufficient. You want to evaluate workplace layouts and consider making certain stairways and hallways one way if social distancing guidelines can't otherwise be met. You want to close or modify certain common areas such as lunchrooms and time clock stations so your employees can socially distance. And you also may want to consider using plexiglass shields, tables, or other barriers to block those airborne droplets. I also recommend that you engage your employees in setting up these processes. And so management should do a first cut at what the plan looks like, but employees should be involved at some point so that you get their buy-in. And it'll also help you avoid forgetting about some of those things that we know management tends to forget about. And it'll also generate goodwill. So engage them once you have a good idea about what you want to do. Now, finally, there's PPE and masks. Masks are not PPE. Now, masks are recommended by the CDC and an extremely effective way to prevent the spread of the disease. And some states are requiring that everyone wear a mask or face covering when outside the home. So you'll likely want to require that employees wear masks while they're at work. My personal philosophy would be no mask, no work. And so here are some considerations for you. Who will be responsible for supplying and paying for masks? Will you provide them, or will you ask your employees to do so? Some states or municipalities may require that you provide them or at least reimburse your employees. But remember, masks can be made simply out of basic household materials. Now, what if employees refuse to wear the mask? Now, there's really only one reason in which it's okay for an employee to refuse to wear a mask, and that's if they have a medical condition that wearing a mask would exacerbate. And in that case, we would want to talk about an accommodation. So remote work or a leave of absence if remote work isn't possible. And assuming there isn't a medical condition and they refuse to wear a mask, send them home. This really becomes a disciplinary issue, and if there are repeated instances of not wearing a mask, you should counsel, discipline, and terminate. This is a serious workplace safety issue. From a public health perspective, the safest thing we can do is have our employees continue to work from home until a vaccine is developed and widely deployed. Zillow, the online real estate portal, just told their employees that they can work from home through the end of this year. Google just announced the same thing. I think it was just a day or two that Twitter told their employees that they can work from home now indefinitely. Given the nature of many businesses and vaccine development timelines, I do realize that this isn't realistic for many employers. I totally get that we're all trying to balance lives and livelihoods. So in lieu of continuing to telework, a comprehensive set of actions will be needed to keep your employees healthy and lower the risk of reinfections. So let's talk about the CDC guidance for keeping the workplace safe, which you'll also want to include in your safety and infection control plan. So if you haven't familiarized yourself with the CDC interim guidance for business and employers, it's a great document for you to review. So the CDC recommends that employees wash their hands when they enter the business and then schedule regular washings. Perhaps get everyone to get up once every hour or two and wash their hands. Provide disinfecting wipes. You should also schedule disinfecting of regularly touched surfaces. And so this isn't encouraging employees to do this occasionally, but it's actually making it someone's job, and it might ultimately be your job. And so you want to consider all surfaces, door handles and knobs, microwaves, refrigerator door handles, sink handles, the water cooler button, etc. I recommend that you do a search for COVID List N. This was put out by the EPA, and it's a really long list of things that will kill COVID, and you might find it helpful in your personal life as well. The CDC is now saying that we should increase ventilation with outside air, basically acknowledging that this can be transmitted in the air, which is why we should require employees to wear masks. And so where you can prop doors open, you should do so. Cancel travel plans. So non-essential travel isn't recommended in phase 1. So continue to use video conferencing, and if it's not available to you, use conference calls, just multiple line phone calls, whatever you can come up with to avoid in-person meetings. And if you need to have multiple people in one space, make sure that you provide at least 6 feet of distance between them. And so this will mean putting capacity limits on your conference rooms and any shared spaces. Another point about travel, if employees do travel, you need to evaluate those circumstances and consider if a quarantine should be required upon return. Eliminate shared food. So often there's communal food. Lots of us have that huge bowl of candy, and people are trusted to pour or use a scoop. You want to get rid of this. There's no good that can come from having containers that dozens or 100 people can touch in the kitchen. If you're open to the public, figure out a way to stagger your customers. So perhaps set appointments for customers and then follow whatever local government guidelines you have, such as no more than 10 people in one location or whatever those rules may be. Now is a great time to figure out how to sell your products online if they can be sold online, and how to stay in touch with your customers electronically. So this is one of those strange silver linings that will come from this. We're going to learn how to do some things that we didn't know how to do before, and a lot of it will be distance and technology based. You want to remove tables and chairs if you have them. This will force the distance and ensure people don't congregate. You also want to make sure that you're mandating physical distance. And this can be done by putting tape on the floor to keep people a certain distance apart. If that doesn't work for your workplace, make sure that you're watching employees to make sure that they're keeping that 6 feet of distance. And social distancing will likely be recommended for the foreseeable future, including in the workplace. So you just want to consider what this means for your workplace. And again, staggering people's return to work, so return them in cohorts versus everyone at one time, considering alternating work days of employees in the office to reduce density, rearrange office space, limit in-person meetings and interactions, consider buying equipment or furniture to further segregate employees. Okay, so employers may be required to screen employees for COVID each day before allowing them to work. And this means taking temperatures and questioning them each day. Now, typically, these types of screenings, they're not allowed for workers. They would be considered a medical exam or a disability inquiry or both, and the ADA would forbid this. But under the circumstances of a dangerous global pandemic, this is allowed right now. But we also need to make sure that we're not creating more risk through taking temperatures. And so if you do it yourself, you should find a no-touch infrared forehead thermometer, and the person who's put in charge should be trained or read up on protections that they should take. And if you can't find a forehead thermometer, it can get a little dicier because you would have people trading things between their hands, and you probably don't want to do that. Another option is employee self-reporting, and then there are also third parties offering these services. And so you need to think hard now about how you'll manage this in the safest way possible. in addition to temperature, you want to ask employees about any symptoms that they may be experiencing, like fever, difficulty breathing, that dry cough. Recently, the CDC added some more common symptoms. Those include headache, muscle aches, chills, sore throat, loss of taste and smell. And then you also want to ask employees about potential exposures that they've had or any travel. And then in addition to your employees, you're also going to want to ensure that you apply these requirements to anyone that enters your workforce. So that's vendors, customers, the UPS guy. Now, we don't want this screening to lull us into a false sense of security. So just because you've taken temperatures and asked about symptoms, don't think that your workplace is free from the virus, because that may not be the case. I suspect that a lot of people logged on today have it and don't know it. Carrying COVID asymptomatically is not uncommon. So don't be lax in your other safety measures, and don't let up on the social distancing. So some considerations for you: who is going to do the screening? So it's probably not likely that you have an employee on staff with a medical background, and it may be prohibitively expensive to hire such an individual. Therefore, you want to choose an employee or a small group of employees to perform these checks. And in choosing these employees, keep in mind that they will have an obligation to keep the information confidential. So for this reason, it may be desirable to have HR or other management employees performing the screening instead of the employee's direct supervisors. You also want to ensure that you can attain equipment and PPE for anyone doing these checks. So obviously thermometers, gloves, masks, eyewear, and gowns. And again, these items are sure to be in short supply, so you need to start working on getting this now. You want to think about how you will log the temperature checks. Will you log all of the information, or only employees at the CDC noted 100.4 degrees? Where will you stage this process? So ideally, right when your employees come into the workplace, so that any infected individuals don't bring it further into the building. How will you limit crowding? So perhaps by staggering the start time of your employees. Almost as important as the screening itself, you need to ensure that sensitive personal and medical information is kept confidential, and that employees know this. And so this might include the creation of a screening barrier. Additionally, all documentation should be kept in strict confidence and in a separate medical file, and should only be accessible on a need-to-know basis. Finally, employees performing screening should be instructed not to discuss the results with any other employees. So let's talk about specific health issues. So if an employee is diagnosed, do we tell everyone else? So you should notify other employees that someone in the workplace has COVID, but you should generally not reveal who that person is. Now, if you work in a very small workplace, it is very possible that they're going to figure it out. If there's one person out on sick leave, and if you issue this notice, employees will know, and that's fine, but we don't need to help them. You have a responsibility under the ADA to keep this medical information confidential. Now, despite this, there are going to be some circumstances in which you're going to have to disclose to others if someone's been exposed or is suffering from COVID. And you're going to have to balance the sick employee's individual privacy interest with overall employee safety. Now, the EEO recognizes that this is an issue, and they've taken the position of more leniency. And so you should try to disclose without identifying the sick employee if possible, but there is more flexibility as long as you can show that it was for reasons to protect others and on a need-to-know basis. Now, what about employees who are out sick, but we don't know why? Can we ask them? So once again, you wouldn't generally want to do this. This would, again, not be permitted under the ADA, but under the circumstances, we need to know if there's been exposure in the workplace. And so you want to keep your inquiry specific to COVID. Don't ask open-ended questions, but do ask, do you have a fever, shortness of breath, dry cough, or other symptoms that are on the list for COVID? Can we require a fitness for duty or doctor's note? So yes, you may require this documentation, but you also want to keep in mind the challenges with getting such documentation during a pandemic. And a lot of people don't want to go to the doctor right now. So you'll want to be flexible here and perhaps accept a telework note. Now, what about employees who have some distant degree of separation from someone else who had COVID? So for example, you have an employee whose roommate is self-quarantining because the roommate's boss was self-quarantining because the boss had potential exposure to COVID. Do we need to make our employee go home and stay there? So honestly, most people in the country have probably been that close to COVID at this point. The CDC doesn't currently recommend any special scrutiny for people exposed to asymptomatic people with potential exposures to COVID. Now, if you decide to send someone home anyway because of that third degree of separation, I recommend that you find work that they can do from home, or if they can't work remotely, pay them for that time and don't take it from their sick leave or their PTO bank. Now, what if an employee is afraid to come to work? So this is where open dialogue is needed. Are they afraid of exposure to the virus? Do they have childcare issues? Do they have an underlying medical condition? Maybe they're happy at home wearing sweats all day. So there are a lot of nuances here, but a generalized fear of becoming ill is not a reason for an employee not to come to work. So the short answer is yes, as long as you've taken appropriate precautions and there's not a legitimate threat and they don't require an accommodation, yes, you can enforce your attendance policies and make your employee come to work. Now, if they decide to stay at home anyway, they wouldn't be eligible for FFCRA leave. Now, it's slightly likely that they may be eligible for unemployment insurance. All of those rules are changing very rapidly right now. Now, if your workplace is not allowing people to wear masks and really not enforcing physical distance, if that person wants to stay home because they legitimately feel unsafe in your workplace, they will almost certainly get unemployment while they're out. But my caveat to you during this time is that employers need to demonstrate flexibility and empathy. So this is where that positive communication needs to come in, and you need to understand the reason for your employees' hesitancy. You need to take the opportunity to allay their concerns and share with them everything that you're doing to keep them safe. Now, we will address what to do if they have an underlying medical condition shortly. And so to sum this up, I really don't view this as a black and white issue. Empathy and understanding are needed, and a flexibility to work out solutions for helping your employees return and feel comfortable doing so. It's going to be imperative here. So what happens when you have a sick employee? So of course we know we're going to send them home. And as a side note, as an employer, you're always able to send a sick employee home if you believe that they have something that is contagious. Now, we obviously don't want to send an employee home if they're sick with anxiety or a sprained wrist or something that they can work through. But you should most certainly do this now. So if anyone is experiencing any of the symptoms of COVID, they should be sent home immediately. Now, as for when they can come back, that should be up to their healthcare provider. A lot of people are not going to get tested for this because testing availability is still very limited. Now, the current CDC guidance is that they should stay at home for at least 72 hours after they have recovered, symptoms are improving, and it's been at least 10 days since they started experiencing symptoms. Again, it's best that they talk to their doctor, but that's the guidance that they'll most likely be provided. What about employees with sick family members at home or other close contact for a prolonged period of time? Now, you'll know this if you're doing those daily health screenings with your employees. Now, if an employee has a family member who lives with them who has been diagnosed with COVID and that employee does not have symptoms, that employee should be self-quarantining for 14 days. That's basic CDC guidance. We definitely don't want them in the office. They should be sent home, and they would be eligible for EPSLA leave if they call their doctor. Employees who have symptoms should follow the CDC guidance that we just discussed. Now, for the employees that they work with, of course, this is why we're social distancing. This is why we're wearing masks, which are very effective. And so in those cases, they should self-monitor for COVID symptoms and stay at home if they develop symptoms. Leave. So many employees will have exhausted their paid time off because one of the things companies were doing before furloughs and layoffs was to keep paying employees by having them use their leave in order to get paid. And so when they get back, possibly with no time left and perhaps 6 months left in the year, how are you going to handle vacations and illnesses and needed personal time? And so if we're talking about vacation, there are no requirements that employers provide paid vacation. And so you can probably do whatever you want to do here, but you should think about this from an employee relations perspective. Do you give them additional PTO? Do you let them take leave without pay? Do you advance leave, or are you a stickler and deny them the time off because you need them back and working? And so most of this will be at your discretion, but you should start thinking about this now rather than trying to address it when you get the question and you have no idea about what you're going to do. Now, when we're talking about sick leave, though, particularly if you're in one of the states or localities that has mandatory paid sick and safe leave laws, there can be issues. Now, if you have separate vacation and sick leave banks, your employees may still have sick leave because they probably didn't touch that before furlough, so you're probably fine. But if you have a combined PTO bank where employees can use the leave for any reason, if you made them use all of that leave before or during furlough, you may have an issue if an employee needs to use leave for an issue covered by sick and safe leave, because this is, they didn't technically have the opportunity to use the leave. And so you may have an obligation to provide them with leave for this purpose. So you might want to start thinking about how you're going to handle that. I am hopeful that we'll see some guidance in this area, and it will most likely come at the state and local levels. Finally, keep your eyes open for new leave laws. I do think it's very possible that states and localities will pass leave laws that you need to provide an extra number of days for COVID sick leave. So traditional FMLA and ADA claims are likely to increase, and particularly in the areas of mental health conditions such as anxiety and depression. And so you want to make sure that your policies are in good shape and just be prepared to follow your normal procedures. For traditional FMLA, the FFCRA FMLA leave counts toward the regular FMLA entitlement. And so if someone's already used their 12 weeks of FMLA to care for their child whose school is closed, they won't have any FMLA. And so in this case, you'll want to consider if an ADA accommodation is appropriate, and you want to remember leave is a form of an accommodation, and work through the ADA active process. Now for FMLA, serious health conditions require an in-person visit, but this is difficult right now. So will you consider a televisit as acceptable in lieu of an in-person visit to establish that serious health condition? You'll probably be safe to do that because you're trying to help your employee and give them the FMLA. I do expect we'll see some guidance on this in the future. Doctors' certifications for both FMLA and ADA may be difficult to get right now, so you want to be mindful of that and think about how you'll accommodate that. Perhaps designate the FMLA or make the accommodation and then get the certification later. Now, FMLA will not apply to employees with underlying health conditions, but the ADA most likely will. So these will be the circumstances in which employees are afraid to come to work for good reason, like they're high risk. If they suffer from diabetes, if they're getting chemotherapy, if they have asthma, you need to accommodate that. And in many of these cases, the accommodation would be to work from home. And if that's not possible, a leave of absence may be an appropriate accommodation. And it can be paid or unpaid, just follow your policies. So teleworking is going to be more important than ever right now and will probably remain so for the rest of this year and even longer. So let's talk a little bit more about that. So many feel it's best to keep employees at home if they can work effectively at home. We don't need people crowding the workplace, and the more we can do to limit employee interaction with others, the better, and the more distance we can create, the better. So you want to be prepared to explain in advance to employees which jobs will be permitted to continue to telework, which won't, and why. And if you haven't already, now is a good time to shore up your work from home policies. And so you want to talk about hours of work. How many hours do you expect your employees to work from home? Hopefully just their regular hours. I wouldn't add on the time that they usually commute and tell them that they should be working more. Everyone's really stressed right now. And so if you don't have a good reason for people to work more from home, I wouldn't ask them to. Be clear about your expectations regarding reachability. Do you want your employees to be on Slack or Skype, Google Hangouts? How do you want to be able to get to them? Or do they just need to have their phone handy? Now you can set expectations regarding productivity. You can say, hey, we expect you to be as productive as you are in the office, but personally, you might want to consider your own expectations and if they should be a little bit lower. So a lot of employees are set up really nicely to work from home and they're getting even more done than in the office, but that won't be true for everyone. And a lot of people have kids at home and that's going to significantly impact their productivity. And so you want to be flexible here. Also address whether you want them to be conducting regular check-ins. Should they be checking in with their managers and subordinates and how often? Every 2 hours, every 2 days? Do you want a daily huddle? Just decide what that looks like. And then finally, you should discuss reasonable office expenses. And so some states are very particular about covering all reasonable and necessary business expenses. And so you wouldn't want to get into a fight with an employee who just gone out and bought themselves a nice monitor because you might ultimately lose that fight. So set expectations ahead of time. You can say, everything needs management approval, or you can ask for pre-approval after expenses exceeding, say, a certain amount. For example, $50 in the aggregate. And so in this case, the employee can spend up to $50 and should, of course, keep the receipts, but beyond 50, they need to talk to someone. Whatever you want this to look like, that's fine. Develop a policy and communicate it to your employees. So there are a lot of compensation issues relative to COVID. So must employees be paid for time screening? So the law is very unclear on this, and it says if the activity is integral to the work the employee is doing, then the employee gets paid. Now, if you want to know what that means, Don't ask me. So since guidance hasn't been provided on this, I would err on the side of caution and pay them. A related Amazon case went all the way to the Supreme Court regarding time spent checking employees' bags, and this just isn't worth being a test case for. Can I pay my employees more? For example, hazard pay, attendance bonuses, etc. So you have managerial discretion as it pertains to employee pay. Yes, you may pay your employees more. However, you want to be mindful that non-discretionary items like hazard pay and attendance bonuses are included in your non-exempt employees' regular rate of pay. And that means you would need to count those monies in calculations for overtime. A way to avoid that, if you want to, is to provide discretionary bonuses. Also, the longer you have non-exempt employees working from home, the more likely there are to be issues. So the FLSA, that's the Fair Labor Standards Act, still applies. And so timekeeping, breaks, off the clock concerns, all that still exists. And when you're working from home, it's really easy to work off the clock. So make sure that your policies are clearly communicated for non-exempt employees and that your supervisors are enforcing them. Can I reduce employees' pay? Again, decisions on pay are completely at your discretion. Now, there are different concerns for exempt and non-exempt employees, so we'll address those on the next slides. So pay for non-exempt employees. Here are a few reminders about pay, particularly if there's a lack of work or you're sending employees home because they're sick. So non-exempt employees must be paid for all time worked, even at home and even if it's fairly small. Now, there is a rule called the de minimis rule, meaning if someone does an amount of work so small that it's impractical to track, then we don't have to pay them for it. So this is like a minute here, 45 seconds there, 2 minutes over there. Over the course of the week, that would be de minimis. But if you're sending a daily email about the state of the company or asking people to respond to a survey about availability or a 5-minute task here, a 10-minute task over here, you should pay them for that. Just add it all up and pay it through payroll. If you send a non-exempt employee home partway through their shift, if you're in about a dozen states, you may owe reporting time pay. So these laws guarantee an employee payment for a minimum number of hours when the employee reports for a scheduled shift. And in those states, even if the employee works for 5 minutes, or if they report to work and they don't do any work at all, the employee is entitled to a minimum payment. So for example, California requires that an employee be paid 50% of the scheduled shift at the regular rate, but not less than 2 hours nor more than 4 hours. Now, the time the employee works certainly can be included in this total. You may reduce hours and you may also reduce the hourly wage, but it must stay above the federal, state, or local minimum wage, whichever is the highest. And you also may not retroactively change pay. Employees must be given advance notice that you will change their pay. Finally, your employees may not opt to work for less than minimum wage, and they can't sign away their right to overtime. When they later change their mind and they find an employment attorney, it'll be an easy win for the employee and a costly mistake for you. For exempt employees, so people who are on a salary, we cannot take a partial day deduction. So if we're sending employees home after working only 4 hours, we can't say we're taking 4 hours off your pay because you didn't work. So that doesn't work for non-exempt employees. Now you can fill it in with paid time off if the employee has it available. Remember that if an exempt employee does any work during the week, they are entitled to their weekly salary. Now, there are some exceptions to that. If an employee misses a full day due to personal reasons, so for example, they're afraid to come to work, you may take a full day deduction. Also, if they miss a full day because they're sick, and if they don't do any work that day and you have a sick leave plan, then you can take a full day deduction for that as well. Of course, if they're sick due to a COVID qualifying reason, they would be eligible for FFCRA leave. You can implement a pay cut for exempt employees for everyone or for certain departments or jobs, but you do want to be careful of unintentional discrimination if you do this by job group. So it's a little antiquated, but it's not totally uncommon that, for instance, a software development group would be all male and the admin group would be all female. And so we don't want to keep the devs at full salary while we give the admin team a cut unless there's a really good reason, like the devs are working twice as hard, but there's limited admin work due to the work slowdown. And so if this is the case, let's just document it really well why we've chosen for certain people to get pay cuts and others to not. Exempt employees have their own minimum. It's $684 a week at the federal level. It is higher in some states like New York and California, and we can't prorate that. So for example, if you cut a $40K a year employee salary by 20%, that brings them in lower than that $684 weekly threshold, and they become a non-exempt employee. And that's okay, but you just need to ensure that they're treated like a non-exempt employee with regard to things like timekeeping, overtime, meal, and respite breaks. Also, you can't change pay too many times or the DOL will look at it as an attempt to circumvent the salary basis test. So my best advice is to change pay twice, once down and then once up to return it to the normal salary level. And in no case should you make salary changes for exempt employees more often than once every month or two. Now, if you don't have enough work for exempt employees to do to warrant paying them the federal or state minimum, you may reclassify them as non-exempt. Now, generally, we don't want to be reclassifying exempt employees as non-exempt back and forth, because that's going to look like we're trying to avoid the rules of the salary basis test. And so I wouldn't recommend that, that you do this for less than 1 month at a time, but you can certainly do this. And right now, employers who are classifying their exempt employees as non-exempt, they're doing it indefinitely because we really don't know when this is going to be over and when we're going to have full employment again. Now remember, they get rest and meal breaks, overtime, ensure you're complying with state laws on these items. You do want to ensure state notice requirements are met for both exempt and non-exempt employees when changing pay. Many states, DC and several localities, they require employers to provide a written notice to an employee's whose wages will be changed. And then finally, make sure that we're not applying pay cuts or reclassifications retroactively, just like for non-exempt employees. So if you have a pay period of the 1st to the 15th and you want the pay cut to be effective on the 10th, when that employee gets paid from the 1st to the 15th, the first 9 days, they must be at the higher rate of pay. The employee needs to know as soon as you change their rate so they can opt to stop working for you if they want. You essentially have an unwritten contract with your employee. You have agreed to pay them, say, $20 an hour, and they've agreed to work for $20 an hour. And if you change that agreement to 15, they need to be told before you do it so they can decide if they're good with that new deal. So if hours reductions and pay cuts aren't enough and you're going for furlough or layoff like a lot of employers are, there are some other things to think about. In short, a furlough is an employer-mandated temporary unpaid leave from work, which employers typically resort to as a cost-saving measure. And employees can be furloughed for as short of a time as a week or as long as months. And in some cases, employers may allow employees to use their PTO, but if there's a cash flow issue, that option is not likely to help you. An employer may require all employees to go on furlough, or it may exclude some employees who provide essential services. So generally, the theory is to have the majority of employees share some hardship as opposed to a few employees losing their jobs completely. Unlike layoffs, furloughs reduce labor costs without adding new costs, such as severance and outplacement. And then when business is on the upswing again, you don't have to pay for recruiting, selection, socializing, training, because the furloughed workers can simply pick up where they left off. Now, employees may not work during a furlough. If they work, they get paid. And this is especially sensitive for exempt employees, because if an exempt employee works, even just checking email for 15 minutes, they must get paid for the entire work week. So given that, if you're furloughing your employees, I recommend that you remove access to your network, email, and the like for any employee you furlough. And if an employee does work, make sure that you pay them. You can discipline them. It becomes a performance management issue, but you still must pay them. During furlough, employees generally will retain their health insurance benefits, but that's not guaranteed. So you want to check with your broker or insurer. We are seeing a lot of the insurance companies be really lenient and allowing furloughed employees to stay on coverage without being COBRA'd up. You should communicate in writing, indicating the number of weeks or months they'll be furloughed, and also how you'll address benefit payments, if they may use PTO. And if they're not getting paid, encourage them to reach out to their unemployment office. It's very important to maintain communication with your furloughed workers. Once every week or two is reasonable. It's a lifeline, and the communication will help to relieve their anxiety, and it'll only help your employees feel more favorably toward you. For the remainder of this year, I wouldn't be surprised if companies do rolling furloughs where not everyone is out at the same time. So some companies may tell employees, we expect you to take 1 or 2 weeks of furlough between now and the end of the year, and you need to schedule them in advance. Layoffs. Now, there can be some confusion about the term layoff. So a layoff used to refer exclusively to a temporary interruption in work, but it's evolved, the term has evolved to a permanent elimination of a position. So to be clear, I am going to talk about temporary and permanent layoffs, since I know that's the reality of what companies are facing today, but there really is no difference between the two. Any layoff is a termination and a complete separation from employment. Now, an employee is laid off because there isn't enough work to do. Now, if the employer, however, believes that the condition will change, they should communicate that they intend to recall the person when work again becomes available. Now, benefits terminate, but sometimes an employer will pay for COBRA or state continuation coverage to allow employees to maintain benefit coverage for a defined period of time as an incentive to remain available for recall. Of course, employees are able to collect unemployment benefits when they're laid off. You want to communicate a layoff in writing, but I do recommend that this is not the first and the only way that you communicate. And sadly, I have seen this, and it doesn't serve you or your brand well for your employee to find out about a layoff in email. In your communication, give an estimate of when you think you may recall employees. It doesn't have to be written in stone, but expectation setting and even later resetting is a good thing. So choosing who returns, after you have a sense of which departments or how many people from each department you'll be calling back, you want to turn the focus to which individuals. So potential criteria may include unique or difficult to replace skill sets. And so these are the people, if you lose them, it will be a huge loss to your business. Overall performance is a good consideration. Seniority employee, this is more typical in union environments, demonstrated ability and willingness to do work outside of their usual assignment. So sometimes we have employees who are not so willing to be flexible. And this is a time that you may need that flexibility. And so this can be a good criteria for selection. As with when making layoff and furlough decisions, you also need to make non-discriminatory choices when deciding who to bring back. And they need to be documented just like when making furlough and layoff decisions. Some employers think that they're doing a favor for an older employee or a high-risk employee with underlying health conditions by choosing not to bring them back. But that's discriminatory, and that's not your decision to make. That's the employee's decision to make. Now, if an employee asks not to be returned because of one of those reasons, you may certainly consider that. That wouldn't be an adverse employment action. When we return employees from a furlough or layoff, you want to provide a recall letter that covers any changes to their position, pay, reporting structure, or responsibilities. You also want to let them know the steps that you're taking and the policies that you're implementing to keep the workplace safe. And then finally, this letter should indicate how they should confirm or deny that they will return, and make sure you include a deadline for response. This is important because unemployment offices in some states are now sending letters to employers wanting them to report if an employee declines employment, because in theory, that individual would no longer be eligible for unemployment anymore. Now, if the employee doesn't respond, you should assume a voluntary resignation. Again, this letter will be important for purposes of unemployment. When you rehire after a layoff, you want to treat these individuals as new employees with all of those normal obligations: offer letter, new hire paperwork, reporting to the state, benefit communication, W-4. Remember, a new one came out in January, that though your employees won't like it because it's a lot more complicated than the old one. The only thing that you might not have to do is the I-9. So a new I-9 is not necessary if they are rehired within 3 years of completing their original one. And so if you initially hired the employee 2 years ago, no I-9 is necessary. If they were initially hired 5 years ago, you need a new I-9. Okay, so permanent separation from employment may be necessary because the work no longer exists, nor does the employer anticipate that these circumstances will change. And sadly, we know a number of businesses won't recover from this crisis, or will determine that they don't need the same levels of staffing. And so you need to determine and document the criteria for deciding which employees will be let go, and then must apply the criteria and document the application of the selected criteria. So here it's important that you look at objective criteria. So common criteria include performance evaluations, performance calibrations, write-up or disciplinary action. Tenure is one of the easiest, but it generally won't serve you the best. But even if you don't have this type of formal documentation, there are a number of other items you can consider, such as history of tardiness, production or sales numbers, and emails of conversations that never made it to the file. It's really important that you check for discrimination or bad reasons that you might be laying an employee off. So disability, high-risk individuals, use of protected leave, pregnancy, gender, religion, race, etc. And so when managers are making these decisions, it's important to ensure that none of these discriminatory reasons are creeping into the decision-making. I know that time pressure on leaders in HR is enormous right now, but it's critical that you minimize the risk that bias will infect the process. And this is both it's both a moral imperative as well as a legal one. And this process should also be used for furloughs and temporary layoffs. Don't forget about warn. You're usually not required to give employees advance notice of your layoff. However, larger employers may need to give a certain amount of notice when conducting mass layoffs or plant closings. The Federal Worker Adjustment and Retraining Notification Act applies to employers with 100 or more employees and requires that they give 60 days advance notice of plant closing or mass layoff that will last at least 6 months. There are exceptions, including when the closing or layoff resulted from a natural disaster or business circumstances that weren't reasonably foreseeable 60 days before the layoff. And so this exception would probably apply to mass layoffs due to COVID-19. Please also note that states have mini WARN acts, and so you want to make sure that you can comply with those. With permanent layoffs, benefits terminate. COBRA or state continuation coverage must be provided for health benefits. And of course, employees will be eligible for unemployment. Now, laid off employees are generally entitled to a number of benefits that employees who are fired are not. So for example, a laid off employee is often entitled to a severance package and perhaps outplacement support. Now, these benefits are not required. And clearly at this point in time, I understand that employers can't afford to provide severance or pay for outplacement benefits. But if you do decide to pay severance, be mindful that these can be a legal minefield. Do not pull a severance agreement off the internet. There are different requirements for different situations, depending on the age of the employee, the number of employees that are being terminated. In some cases, there are required timeframes that you must give employees to consider the agreement and a revocation period, enabling the employee to change their mind after they've signed the agreement. So just make sure you work with an HR professional or an employment attorney when crafting these agreements. And of course, in addition to giving your employee a little cushion, the purpose of the agreement is a release of employment claims. Outplacement is also not uncommon with a permanent layoff or a reduction in force. And this is where employers provide services to help their employees find another job. So this includes resume writing, LinkedIn profile development, one-on-one coaching to help employees navigate the job search. And so I have to give a plug to iHire here. So they just launched a new outplacement product. And so if you're interested in that, check out their website or call their customer success team for more information. And then finally, the way that we treat employees during times like this it's really important for your brand and for future employment prospects. So even when the outcomes are negative for our employees, those who feel that they've been treated with respect and open communication, they will still think favorably of you, of course, assuming they did when all this started. You know, the employment market will rebound eventually, and employees have a long memory. So please be mindful of that during these difficult times. And that is what I have for you today.
All right, thank you so much, Lisa. That was a great overview of how to keep your employees safe and your workplace compliant upon returning to work. So next, Lisa is going to be taking questions from our attendees. So if you haven't already submitted a question, please feel free to do so now via that Q&A chat box at the bottom of your screen. We will try to get through as many of your questions as possible. So Lisa, back to you.
Okay, so it looks like we just have a couple questions. So should employees still wear a mask if they are not in contact with another person less than 10 minutes? So the answer to that is yes. And that's because if you're not wearing a mask, those respiratory droplets, they can spread and they can last on surfaces, and it depends on the type of surface, but for a period of time. So other than when they're eating, they should be wearing a mask at all times. All right, one of my furloughed employees left Massachusetts for Florida at the beginning of her furlough. Was she allowed to do that? We have recalled her and she doesn't want to get on a plane now, so she is refusing to come back. What can I do? So this is one of those examples that we discussed. You have offered her employment and she has elected not to come back. I certainly understand the hesitancy not to get on the plane, but that was her decision to make. You want to make sure that you document that. Again, the unemployment offices are reaching out to states for this very reason. And so that unemployment office may be reaching out to you, asking for specific information. And in theory, you could and should provide that information to them. As a side note, all of the unemployment offices are, they have phone numbers set up for fraud. And so that's just something to be mindful of. Can an employee who is on FMLA caring for a family member be terminated during the furlough or layoff? The employee has performance issues and there is no work available. So an employee cannot be terminated for using FMLA. That would be retaliation and that would be illegal. But if the employer is eliminating the job, work isn't available, then yes, that employee can be terminated. This has been one, oh, well, you're welcome. or thank you. For exempt employees who do not have enough time to make up the 8-hour day after working, is it mandatory to pay the remaining 4 hours? The answer to that is yes, but you do have some options. You can advance them the leave, but they do have to be paid for the full day. We have a call center in our office where those employees are on the phone most of the day. Wearing a mask will be difficult in that type of job. Can we make the requirement to wear a mask dependent upon the type of job in our office? It's a good question. I have watched the news and I see reporters wearing masks while they're reporting. I know it does make it a little difficult. I do think that you're opening yourself up to some liability there. If there's any ability for those individuals to work remotely, I think that's something to consider. So I would want to give that some more thought, and so maybe reach out to me after this webinar, so I can help you consider some options and some solutions there. Do my current employees that I've had for years need to fill out a new W-4 since it's changed? If they have been furloughed, they do not. If they have been laid off and you're rehiring them, yes, in theory they do. But the law stipulates if you have an employee who has not filled out the W-4, they would automatically be classified at the single and highest withholding rate. And they might not like that, so it would probably behoove them to fill out the new W-4. And I think those are all of the questions that we have today, Erin. Oh,
awesome.
Actually, it looks like we have one more.
Oh,
should the receptionist wear a mask if there are not clients, customers, or employees in the front office. And same as my first response, those droplets can last on surfaces, and so masks should be worn at all times, in my opinion. All right, Erin, back to you.
Thanks, Lisa. And thank you again, everyone, for joining us for today's webinar. Keep an eye out for follow-up communication from our team. We'll be sending out a link to a recording of the webinar, as well as a way for you to view the slides. Thanks again, everyone. Have a great day and stay healthy.